Good morning. My name is Bob Kruger. I'm one of the, I'm a geriatric internist from San Antonio, and I'm also the Texas representative to the council, Texas counselor. And it's my pleasure to be here today, talk to you about hot topics in geriatric medicine. The topic I want to talk about is preoperative assessment of older people. Now, one of the concerns is when we take care of our older people for pre-ops, we're treating them as younger people, and that's a big concern because older people have specific requirements that younger people don't have. So what I want to talk about is the optimal preoperative assessment of the geriatric surgical patient. This is a best practice guideline, and it's a series of 3 guidelines, a collaboration from the American College of Surgeons and the American Geriatrics Society on how can we take care of our older people who are going to undergo surgery. This one is for pre-op. There's one that's still working for perioperative care, and then another one for postoperative care. So our U.S. population is aging, and this slide shows that in 2000, this was kind of our demographics of our patients. And you can kind of see that most of them around 45 to 49. Now in 2025, as the baby boomers are aging, the population curve is squaring. And now we have more people who are older, and look at this, in 2050, look at the 85 and above population. Right now, between 2010 and 2050, the over 65 population will triple. By 2030, those over 65 will go from 13% up to 20%. And again, over 85 is the fastest growing population. There's real concerns, and we need to take care of them. Older people also use more hospital days. Take a look at this. From 1970 to 2007, the population was 10%, up to 13%. In 2030, 20%. Hospital discharges, 1970, 20%. Look at the increase, though. Between 1970 and 2007, the population of over 65s only went up 3%. But look at their hospital discharges and their days of care. Where are we going when this will be 20% in 2030? A big concern. So this article talks about, it's a collaboration between the American College of Surgeons and the American Geriatrics Society on what can we do to take optimal care. Let's come up with some best practice guidelines on taking care of our older people who are going to undergo surgery. The time when you don't want to find out a lot of the specific issues is after you've had surgery. So let's find out before, and maybe we can do something about it. Maybe they're not optimized for surgery yet. Here's the goal. Best practice guidelines, optimize outcomes. And there are going to be outcomes studies on this in practice. So this is, again, the initial guideline. How can we optimally prepare them preoperatively? So let's take a look at this. So history and physical, definitely. But also, should we know something about their cognition before they go on in? Good idea. Can they sign that they want to have this? Do they have the capacity to undergo surgery, to say, yes, this is what I would like to have? Are they depressed? I mean, as you all know, a depressed person does poorer postoperatively in rehab than someone who's pumped up, ready to go. Maybe we need to get them on an antidepressant. Maybe we just need to look at this. How about delirium? Substantial numbers of old people have perioperative delirium. Maybe we need to know a little bit about that. How are they anemic going in? Are they dehydrated? Do they have specific medications that they're taking that might put them at risk for delirium? Are they renally insufficient or hepatically insufficient? What about their substance? Are they one who might use pain medications a lot? Do they use oxycodone and hydrocodone chronically to treat osteoarthritis? Are they alcoholic? Very good information to know before you take them to surgery. Certainly, what's their risk for perioperative myocardial infarction? What's their risk for pulmonary complications? Can you tune them up a little bit more pulmonarily? Let's take a look at their functional status and their falls risk. Is this a very frail person you're going to take to surgery? Or can you buff them up a little bit before you put a new knee in there? How about their baseline frailty? So frailty means that they need additional help with their activities of daily living. One who might otherwise really need some buffing up. What about their nutritional status? Do they have a dropping body mass index, or are they pretty okay? Are they way underweight? Maybe we need to get them a little bit of weight back on or turn their nutritional status around. How about polypharmacy? What kind of expectations postoperatively? Do they have a family? So when we send them home from rehab, do they have somebody who's at home? Very important information to know before we take them to surgery. Maybe we need to do some specific diagnostic tests. So if nothing else, this may be an article you might want to have in your armamentarium because it tells you how to do a whole bunch of very useful tests if you take care of old people. Do you know how to do a mini-cog? Do you know how to do a PHQ-2? Do you know the risk factors for delirium? All that is in here. There's about 15 tables. So it's a great article. How to do a timed get up and go, frailty score. So these are all the tests that this recommends that one doing a preoperative evaluation might want to just think in their mind, definitely not do all of them, but maybe think, are there specific ones that my elderly patient might want to undergo? The future, where are we going with all this? Well, we need to keep our old people safe. We, as a medical community, cannot afford complications, longer lengths of stay. We want to have our old people come, have surgery, go, and have a good outcome. So the American College of Surgery and the CMS, the Center for Medicaid Services, are collaborating on outcomes. Which of these will give you the most bang for the buck? And the same thing for intraoperative care and perioperative care. And that's all my remarks. I appreciate the opportunity. I appreciate your attention. If you have any questions, we'll talk after this, or just grab me during the session. If you're from Texas, please grab me, and I'd be happy to talk to you. I put my email address on here. And just one last thing, if you go to the website, today I'm going to revise these and put 2 more slides on, one talking about depression in the elderly. There's about 7 great articles that talk about optimal treating for depression, and another one on functional status. How can we optimize the functional status of our old people? Thank you very much.